Celiac disease is a serious medical condition. It affects the digestive system. The culprit is gluten. Gluten is a protein found in wheat, barley, and rye. When someone with celiac disease eats gluten, their immune system overreacts. This immune response damages the small intestine. Specifically, it harms the villi, which are tiny, finger-like projections that line the small intestine and absorb nutrients from food. Without healthy villi, the body cannot properly absorb nutrients. This leads to a wide range of symptoms and health problems. Celiac disease is not a simple allergy or intolerance. It is an autoimmune disorder, meaning the immune system mistakenly attacks the body's own tissues. Celiac disease is more common than once thought. It affects about 1 in 100 people worldwide. The good news is that with proper diagnosis and management, individuals with celiac disease can live healthy and fulfilling lives. The exact cause of celiac disease is unknown. However, researchers believe that it is triggered by a combination of factors, including genetics, environment, and immune system dysfunction. A strong genetic predisposition exists for celiac disease. People who have a first-degree relative, parent, sibling, or child with the condition are at a significantly higher risk of developing it themselves. Specific genes have been linked to celiac disease, and these genes are involved in the immune system's response to gluten. While genes play a role, environmental factors also contribute to the development of celiac disease. Exposure to gluten is necessary for the disease to manifest. The timing and amount of gluten introduced into the diet as well as other dietary factors may play a role in triggering the disease. Additionally, certain viral infections such as rotavirus have been implicated as potential triggers for celiac disease. The theory is that these infections may disrupt the immune system, leading to an abnormal response to gluten. Celiac disease can present with a wide range of symptoms, and the severity of these symptoms can vary greatly from person to person. Some individuals may experience severe digestive problems, while others may have subtle symptoms, or even no noticeable symptoms at all. Common digestive symptoms of celiac disease include diarrhea, bloating, gas, abdominal pain, and weight loss. These symptoms occur because the damaged villi in the small intestine are unable to effectively absorb nutrients from food, leading to malabsorption. In children, failure to thrive, delayed puberty, and short stature are possible signs of celiac disease. These growth problems occur because the body is not receiving the essential nutrients it needs for proper development. Adults with celiac disease may also experience fatigue, anemia, and osteoporosis due to nutrient deficiencies. Celiac disease is not limited to the digestive system. It can affect multiple organs and systems throughout the body. This is because the immune system's attack on the small intestine triggers a cascade of inflammation that can damage other tissues. Neurological complications such as headaches, migraines, and neuropathy, nerve damage, are relatively common in people with celiac disease. The exact mechanisms underlying these neurological problems are not fully understood, but they may be related to inflammation, nutrient deficiencies, or autoimmune cross-reactivity. Skin problems, including dermatitis herpetiformis, an itchy blistering rash, and alopecia areata patchy hair loss, can also occur in people with celiac disease. Dermatitis herpetiformis is considered a specific skin manifestation of celiac disease, and it is often the first sign of the condition. Section 5. Unmasking the culprit, diagnosing celiac disease through testing. Diagnosing celiac disease involves a combination of medical history, physical examination, and laboratory tests. A thorough medical history is essential, as the doctor will ask about symptoms, family history of celiac disease, and other relevant medical conditions. Blood tests are typically the first step in diagnosing celiac disease. These tests look for specific antibodies in the blood that are produced by the immune system in response to gluten. Elevated levels of these antibodies, such as anti-tissue transglutaminase or TTG antibodies and anti-endometrial antibodies, are suggestive of celiac disease. If blood tests indicate celiac disease, a biopsy of the small intestine is usually performed to confirm the diagnosis. During a biopsy, a small sample of tissue is taken from the lining of the small intestine and examined under a microscope for damage to the villi. In addition to laboratory tests, doctors also look for clinical signs and symptoms that may suggest celiac disease. These clinical signs can vary widely depending on the individual and the severity of the condition. During a physical examination, the doctor may check for signs of malnutrition, such as weight loss, muscle wasting, and pale skin. They may also examine the abdomen for tenderness, bloating, or distension. In children, delayed growth and development are red flags for celiac disease. Doctors will monitor a child's growth charts carefully and may order additional tests if there are concerns about growth delays. Section 7. Navigating life with celiac disease. Effective management and treatment. The cornerstone of celiac disease management is strict adherence to a gluten-free diet. This means avoiding all foods that contain gluten, including wheat, barley, and rye. Gluten is found in a surprisingly wide variety of foods, so careful label reading is essential. Common sources of gluten include bread, pasta, cereals, baked goods, beer, and certain sauces and dressings. However, gluten can also be hidden in less obvious places, such as processed foods, soups, and even some medications and supplements. Working with a registered dietitian who specializes in celiac disease can be incredibly helpful in navigating the gluten-free diet. A dietitian can provide personalized meal plans, recipes, and tips for eating out safely. Section 8. The gluten-free lifestyle, adapting your diet for celiac disease. Adopting a gluten-free lifestyle requires a significant dietary adjustment, but it is essential for managing celiac disease and preventing complications. Fortunately, there are now many gluten-free products available on the market, making it easier than ever to follow a gluten-free diet. When transitioning to a gluten-free diet, it is important to focus on naturally gluten-free foods, such as fruits, vegetables, lean meats, poultry, fish, beans, lentils, nuts, and seeds. These foods provide essential nutrients and can help ensure a well-balanced diet. It is also important to be aware of cross-contamination. Gluten-containing foods can easily contaminate gluten-free foods if they are prepared on the same surfaces or with the same utensils. Therefore, it is crucial to keep gluten-free foods separate from gluten-containing foods and to use separate cutting boards, utensils, and cookware. Section 9. Essential nutrients, ensuring adequate intake on a gluten-free diet. While a gluten-free diet is essential for managing celiac disease, it is important to ensure that you are still getting all of the nutrients your body needs. Gluten-free foods are not always fortified with the same vitamins and minerals as their gluten-containing counterparts, so deficiencies can occur. Common nutrient deficiencies in people with celiac disease include iron, calcium, vitamin D, and B vitamins. Iron deficiency can lead to anemia, calcium and vitamin D deficiency can contribute to osteoporosis, and B vitamin deficiencies can cause fatigue, nerve problems, and other health issues. To prevent nutrient deficiencies, it is important to eat a variety of nutrient-rich foods and to talk to your doctor about whether you need to take any vitamin or mineral supplements. Your doctor can order blood tests to check for deficiencies and recommend appropriate supplements if needed. Section 10. Thriving with celiac disease, support, resources, and long-term outlook. Living with celiac disease can be challenging, but with the right support and resources, individuals with celiac disease can live full and active lives. Support groups and online communities can provide valuable information, advice, and emotional support. The Celiac Disease Foundation and the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, are excellent resources for information about celiac disease, gluten-free living, and ongoing research. With early diagnosis and strict adherence to a gluten-free diet, the long-term outlook for people with celiac disease is excellent. The damaged villi in the small intestine can heal, nutrient deficiencies can be corrected, and the risk of complications can be significantly reduced. Section 11. Conclusion: empowering yourself to live well with celiac disease. Celiac disease is a lifelong condition that requires ongoing management. While there is no cure, a gluten-free diet is the most effective treatment and is essential for preventing complications. By understanding the causes, symptoms, and management strategies for celiac disease, individuals can take control of their health and live fulfilling lives. Remember to consult with healthcare professionals for personalized guidance and support.